Although there are orthopedic hospitals, some Ghanaians prefer to go to the traditional herbalist and bone setters. Are patients who go to these traditional bone setters, regardless of how severe the problem is, making the right or wrong choice? Can the two groups work together? In the second series of my story on traditional bone setting, I take a look at the work of the two trained orthopedics and traditionally trained bone setters, and to what extent they each can operate. It is exactly 4 a.m. and back here at the countryside, many are now awake, preparing to go to their farms. My camera person and I had to get here this early because according to the bone setter here, the chunk of the people who patronize this service come this early to avoid long queues. As you can see just behind me, work has started. Our mission here is simple: to bring this story to a comprehensive end. I had to wait till daybreak to meet with Nana Osei Kojo, the gentleman whose account was aired in an earlier story. Nana Kojo Osei fell from a high-tension pole while working. Though he reported to a hospital immediately after the accident, he did not see much recovering. Kojo could neither sit nor walk for months. He tells me he can now walk and sit with the aid of a Zimmer frame. It's been 2 years since the incident occurred, and Kojo is still receiving treatment from traditional bone setters at the Jenipankwa Orthopedic Clinic in Kwewu Pepiase, with the hope of getting back on his feet again without the help of an aid. He recounts his condition at the initial stage and how it has affected him.
I was lying in a hammock when I was first brought here. I had pains all over and nobody could touch me. 5 people had to carry me. I could not speak or lift any part of my body, but by God's grace, I am better now. But anytime I talk for long, I have this excruciating pain in my genital organ. There is this fear in me as a result of the fall.
Even though there are no physiotherapists and psychologists to assist people like Kojo overcome trauma, which in turn has delayed his healing process, Kojo says he has no intention, however, of going back to the hospital. To him, the traditional bone setter saved his life where the hospital failed.
My
only problem is that when the herbs are tied to my knee, my heart beats extremely fast, causing me to untie it. It would have been better if psychologists were here to psych me up, but there are none. I therefore have to master and encourage myself to walk again.
His story is no different from others who go in for treatment by traditional bone setters. It is reported that Ghana's former president Jerry John Rawlings once had a fracture and had to go in for services of a traditional bone specialist. So is the case of Ghanaian international and national soccer team captain Asamoah Gyan. Others who patronize this service tell me why.
You could visibly see my bones when I first had the fracture on my leg. I can confidently say that my condition has improved.
Abubakar, hospital.
He is Abubakar. In the course of delivery, the nurse pulled his arm. The arm was hanging, but now it is better.
Kwame Atiarikere hails from Navrongo in the Upper East region of Ghana and the owner of Jinipankwa Orthopedic Herbal Clinic. He has been setting bones for the past 60 years, a craft passed on from his grandfather to him. Mr. Atiarikere is aging and has therefore trained his sons, Yao, Balore, Nase and David to take up the trade. He explains how they treat a diabetic patient with a fracture.
We don't treat diabetes as we do not have what it takes to do so. But if one has diabetes and is suffering from a fracture, we can tie it with herbs to heal completely.
Mr. Atiarikere, however, admits that his center treats everything in relation to bones, but for bone alignment, deformities of the bone, provision of artificial limbs, and other complicated concerns that require critical medical attention. He noted that unlike other bone setters who include orthodox medicine in treating patients, he sticks to his traditional way of practice. Dr. Sabam Kori is a teacher by profession and is 26 years old. According to her, she fell at a tender age which affected her right leg. She had to opt for an orthopedic correction, but the high cost initially deterred her. After several years, Dorcas has now returned to the St. Joseph Orthopedic and Trauma Center in the Eastern Regional Capital to undergo surgery to stop people making the unpleasant comments about her the way she limps. Having confirmed from traditional bone setters that they don't treat special cases such as deformities of the leg, I had to travel all the way to Kofodia in the eastern part of Ghana to witness Dr. Abdul Rahman in a surgical section. He tells me it would take 90 minutes, but before then I had to be in this apparel as it comes with the profession. He tells me that our breath contains some bacteria, so in order not to breathe into the wound to infect it, I have also to cover my nose and my lips. Before it started, the patient had to be given an anesthesia to bring in some numbness in the lower part of her body so she does not feel it whilst they carry on with the operation. German-trained orthopedic surgeon Dr. Abdul Rahman explains further why Dorcas needed to align her deformed leg.
This patient is a case of a deformity of the tibia, what we call the genivarum. She's 26 years. Maybe when she was a kid, it was a case of blunt disease. Blunt disease, that means the bull hair, isn't it? And that was not treated or was not managed. And then she's grown up to 26 years. And you can see the length discrepancy. That leg that was affected was shorter than the left one. So the idea is to correct that deformity and to get good alignment, good length. And that's exactly what we did. And the procedure is called corrective osteotomy.
This procedure, according to Dr. Rahman, cannot be without a challenge.
It becomes a bit more difficult. The bone becomes hardened. So instead of using a normal osteotomy set, you have to use a saw. And that's exactly what we're doing, because with the osteotomy, it's easier to go through the bone. That's for children. But an adult, you have to go for saw.
Physiotherapists are also available to attend to patients, unlike traditional bone setters.
If somebody is undergoing surgery to correct a particular deformity, let's say a genivalgus deformity, where they do corrective osteotomy, after the surgery, we go in there to make sure that the knee joint range of motion is kept normal so that the person can walk normally after the surgery, because there is no point in you going to do the surgery and not being able to walk after the surgery. So we come in there to mobilize the joint to make sure that the joint is free to move, and we teach the patient what to do as far as the surgery is concerned, or after the surgery has been done, so that the person wouldn't sort of get any further injury after the surgery, and the person will be able to move and go back to his or her normal activities after the correction of whatever deformity that we treated.
For the St. Joseph Hospital, Wednesdays and Fridays are considered orthopedic days. Usual with hospital procedure, patients retrieve their folder, locate the history table, where the patient's records are taken for examination before consulting a doctor. Peculiar situations like severity of fracture require that patients are admitted in any of the wards in the 200-bed facility.
Averagely, we see between 200 to 300 on orthopedic days. We check their blood pressure and then we check their weight in order to give them the correct doses of the drugs. So the weight checking and the BP helps us to fish out those who are having problems and again give them the right dosage of treatment.
I sampled views of patients about treatment by traditional bone setters. The patients never saw the need to consult a bone setter for a bone-related problem.
I had some pains in my knee, so I came to the hospital. They treated me, gave me some medications. I went and used them, but the pain didn't go. So I came back and I was referred to the orthopedic doctor who requested for an X-ray. In fact, I didn't think of going for any traditional medicine. I thought straight of coming here. It was after the X-ray that the doctor established that it is arthritis, which is somehow related to the bone.
When you first had a fracture after playing the football and all, did you ever think of going to a bone setter or you came straight to the hospital?
My colleagues were just advising that whilst I was on the ground that they should take me to the local people. They can do it well. I decided that no, I don't like local. They have to rush me to hospital because I've seen people who have gone to the local and then came back to the hospital for correction. So I've decided to go to the hospital for my treatment.
Like the hospital, traditional bone setters like Mr. Atiarikere insist on an X-ray film from every patient before treatment. His center also keeps record of every patient they attend to. Rooms on the compound, though not enough, serve as wards accommodating patients in critical condition, while taxis are readily available to serve as ambulance in carrying patients to their destinations. Unlike the hospital, bone setters have no special days set aside to attend to patients. Again, while trained orthopedics rely on orthodox medicine, bone setters rely on herbs. Hot water is one basic item they cannot do without. One issue that always crops up when it comes to the treatment of bones is superstition.
We collect a fowl, a bottle of schnapp, a bar of key soap, and an unspecified amount of money before treatment. Bone setting is an age-old practice from our ancestry, so if you fail to bring in the requested items, the spirit can someday ask you to pay your debt. We also have days we pray to instruct the gods to go round and collect all monies in debt.
As an orthopedic, people think to deal with these things, you really need to consult another god.
Oh, I don't know anything about marine god or something, but this is training. You have to undergo it, and it's a long training called 5 to 6 years. So you should be equipped basically to handle such deformities.
Orthopedic surgeons complain that many cases are complicated when especially they are sent to traditional bone setters before being brought to the hospital.
Most of these herbs are very toxic. They kind of have effect on the skin and then it turns into infection. There's a similar woman, I don't know who was here, and the thing has turned into tumor. Yeah. So now we have to refer that patient to Kojo, okay, for Kojo to see what they can do about it. But she had a fracture. For 7 months, she was at a herbalist. For 7 good months. And then when the herbalist detected that, he said he has finished with his services. He's finished. So they should come to the hospital for the doctor to take an X-ray. Fracture that has not healed or is healed wrongly, and it's over 4 years, 5 years, and you have to re-operate. It's not an easy job. Okay, it's not an easy job. If it's fresh, it's relatively easier. Okay, but we come with shortening of the leg. The lower leg maybe 4-6 centimeters. That means one leg is longer than the other. But so you have to operate and make sure that you are able to get almost the same length as the other one, the unaffected one, and it's not easy. Okay, so that's the challenges we face. Sometimes we are successful to get it equally. Sometimes there's a bit of shortening. Okay, maybe 1 centimeter or something, which is under normal circumstances is acceptable. So when there's that discrepancy, we send them to the workshop, and then they try to raise the shoes, or they have the devices on a whole lot of orthosis there that will help the patient to get equal length and to be able to walk comfortably.
Dr. Rahman admits that the cost and accessibility greatly account for patients' choice of service.
It's better when they have fractures, they should go to the hospital. Even if the hospital hasn't got the facility for orthopedics, the hospital will refer them to orthopedic centers. There's Kolebu, there's 37, we are here. Okay, there's Kumasi. Okay, but I agree that the services where we are situated becomes a problem. So that's why the bone setters have an upper hand, because they are more easily accessible because they live within the communities. But just as I said, somebody is in a village and has to travel maybe 200 kilometers to come here, or go to Accra, or go to Kumasi. It's not an easy task. Okay, apart the financial, the sort of hustle and bustle to get to the place, it's also something that drives them to the bone setters. Who are more, they got good reception. Okay, and the people are easily accessible, more friendly. Okay, less bureaucracy. Okay, but here there's a big problem. You have to go and register, you have to go and do that, you have to go here, and so. But the bone setter straight to the one who is going to apply the herbs, and they put some kind of spiritual things on it, and that's more suiting to the patient.
For both practitioners, one thing is for sure in the line of duty. That is, after treatment, patients are obliged to go by their instructions to prevent problems and speed up healing. So, asked what the fate of the two, Kojo and Dorcas, will be, Mr. Atiarikere could not say exactly when his patient, Nanose Kojo Ajimai, with his present condition, can be able to walk without his Zimmer frame. On the other hand, Dr. Rahman was emphatic that all things being equal, Dorcas will be well in a month. Clearly, traditional bone setters complement the work of trained orthopedics. Many, especially in rural Ghana, continue to benefit from these traditionally trained practitioners. But the question is, isn't it time for both traditional bone setters and orthopedic practitioners to collaborate more for the greater good? Rebekah Awuah reporting.